Okay, so we talked about this a little bit, but there's population-based healthcare services, clinical prevention, primary healthcare, secondary, and tertiary. So when we talk about population-based healthcare services, we are talking about the entire population and maybe not specifically focused on a certain problem in particular. So population-based, everyone getting a vaccine, because if everybody's vaccinated, then, we're going to prevent a lot of those preventable illnesses. Clinical preventative services. Okay, so that's like people getting their checkup, people getting weighed. We're checking everyone's blood pressure. And then there's primary healthcare, secondary healthcare, and tertiary. So primary is, individually talking with patients about eating well and exercising so that you can prevent overall issues like cancer, diabetes, high blood pressure. Secondary is catching things early, so mammograms, screening blood pressures and blood sugars so that you are catching illnesses in its early treatable stages. And then tertiary is preventing further issues. So all right, you have someone who's diabetic, and now you're teaching them how to take care of their feet so they don't have a complication from their disease. All right, services in public health. So a big thing I want to talk to you about is the idea of population management and what does that mean? Okay, so part of it they talked about genetics in a community. So if you have a primarily Nepali community, Nepali genetics tend to show increased liver issues, specifically fatty liver or non-alcoholic steatohepatitis. And that's where you get buildup of fatty infiltrates in the liver, despite not being an alcoholic or having viral hepatitis or a long-term medication that could cause that. But you could still have liver issues with that. So talking about prevention of this issue specific to that population. The same with one of the number one causes of death in pregnancy is homicide. So having safety assessments and safety conversations with our pregnant women. Any type of vulnerable or population. So we're thinking about the elderly, the young, African American, Hispanic, immigrant, poor, female, transgender. These are all different populations, and we try to look at trends and risks so that we can pinpoint certain interventions toward that population. So we look at population, subpopulations, and then population focused practice. So population is the collection of individuals who share one or more personal or environmental characteristics. So it's also interchangeable with the word aggregate. So pregnant women, that's a pregnant population, right? They have one or more personal. Subpopulations are subsets of populations who share similar characteristics. So how about teen moms, right? So you're already at risk for a lot of stuff when you're pregnant, but what about when you're a teenage pregnancy? They already have a higher risk for preterm labor, gestational diabetes, depression, issues like that. And then, of course, we talk about population-focused practice. So problems are defined and solutions such as toward policy development or providing given preventative services. All right. All right, so types of practice focus in nursing. Hold on one second. I'll just take a sip of my Diet Coke. All right, so population focus is providing services to individuals rather than a population while maintaining appreciation for the community. And then there's individual family group focus, and that emphasizes health protection, health promotion, and disease prevention of a population. I actually think that's swapped. So just keep that in mind. Community-oriented nursing can focus either on the community or the individual that falls within a population focus. And that's important because sometimes focusing on the community is helpful because you need that big picture, and then sometimes you need more individualized care. All right, so let's talk a little bit about the 4 nursing modes in community health. So there's community-based nursing, and we talked about that. So community-oriented nursing, nursing that has its primary focus um, the healthcare of either the community or the population of individuals, families, and groups. It's broader in scope than community-based practice, right? It's a form of care in which the nurse provides healthcare after doing a community diagnosis. So in the city of Cincinnati, community diagnosis at risk for substance abuse. And then you're going to provide interventions to individual and group within that population toward that community diagnosis. Oops, I'm sorry. I keep doing that, and I apologize. Community-based nursing is the provision of acute care and care for the chronic health problems to individuals and the family. And it occurs outside an institution, and the services are provided to individuals and families. So again, this is within the individual and family, within a community, and it's done outside of an institution, so not in the hospital. All right, so community-based nursing. So our goal is to manage acute and chronic conditions, right? So we're focusing on illness care. Whereas community-oriented nursing is to prevent disease and disability and protect and promote, maintain health. So community-based nursing, okay, we're going to focus on hypertensives and that illness care, right? And it's going to be specific to the population. So if you have a poor population where there's food deserts, you're going to focus on the diet because that's where the issues with the hypertension in that community, but it's also focusing on the illness. Whereas community-oriented nursing, you know that they have food deserts and you're focusing on the diet for overall health. You're focusing on safety for overall prevention of disability. So that's kind of the difference. One is just more disease and the other one's more risk. Community health nursing practice, the goal is to preserve, protect, promote, and maintain health individuals and families and groups in a community. Okay, so the practice focuses on the health of individuals, families, and groups and how their health status will affect the community as a whole, right? So how does smoking of the individual affect the community as a whole? Then public health nursing practice prevents disease and disability and promotes and protects the community as a whole versus just the individual. So what are some challenges for the future? So current trends to move more care into community settings and to reduce the number of hospitals, right? So even in the ER, they don't work people up as much, refer back out to the PCP. A lot more work is being done within the community. Now we have group visits, group classes, going into the community to provide care. So going into a church and doing a health screening, going to people's job. That's a big one. So if any of you are interested in going with a nurse who works in occupational health and talking to them about what they do every day, and you know, it was interesting because when I first started working as a nurse and they're asking me all these comprehensive healthcare questions, I'm like, this feels inappropriate. Why does it matter to you if I sleep a lot or what my weight is? And part of it's like, are you fit to work? Obviously, but the other part of it is that occupational health trends go into the population health number. So I get patients all the time who are like, yeah, I was there for my work physical and they said my blood pressure was high. Or yeah, I was there for my work physical and they noticed that my fasting blood glucose was above, 120 or whatever it is. And maybe I need to be tested further for diabetes. And so that is something that's really important. We're moving outside of people coming into the hospital to get care, but we're kind of doing guerrilla warfare and going to the trenches, and then also providing more prevention and promotion, which is starting young. Hey, get your kids moving. Hey, drink a lot of water. Don't smoke inside the house because that's how you get secondary COPD. Wear your seatbelt. That is health promotion right there. Telling people to mow their lawn after 6 to prevent, air issues. That is also population health and prevention and promotion.